You might have heard this line so many times, you can say it in your sleep. Your back hurts because you're old. What do you expect at your age? Maybe a doctor said it in a hurry. Maybe your friends joke about it. Maybe you have even started saying it yourself, half laughing, half resigned, as you sit out of trips, skip walks, or watch your world quietly shrink. But here is the part almost nobody over 60 is told clearly. Yes, your spine has aged, but millions of people your age have the same wear and tear on their scans and do not live with the kind of pain you do. Age and back pain are related, but they are not the same thing. In this video, that gap will be exposed. You will see what is truly normal aging inside a 60, 70, or 80-year-old spine, and what is actually changeable, strength, habits, and the story you have been told about your pain. If you have ever wondered, is this really just old age, or is there something I can still do? Stay with this to the end. Many people over 50 are told, your back hurts because you're old. That's just how it is now. But that is not the full truth, and believing it can quietly steal years of strength, independence, and hope you could still have. What if getting older and having back pain are related, but one is not automatically the prison sentence of the other? In this video, the goal is to separate what is truly normal aging in the spine from what is preventable, treatable back pain, so you can stop blaming every ache on your birthday and start seeing what can still change. My name is Dr. Robert Ellis. For more than 20 years working with older adults, one sentence has been heard more times than can be counted. Well, what do you expect at my age? Often it comes from kind people who are told that back pain is inevitable, sometimes even by well-meaning professionals who are overwhelmed and pressed for time. The science now says something very different. Let's start there, because if you do not see the numbers, it is hard to believe the hope. First, yes, low back pain is common in older adults. Studies show that in community-dwelling seniors, anywhere from about 1 in 7 to 1 in 2 people report low back pain over a year, depending on how you ask the question. That is a lot of people, and it can have a big impact on daily life. But here is a crucial fact. Major international pain organizations are clear that despite its high prevalence, low back pain is not an inherent, unavoidable part of aging. In plain English, many older people have back pain, but age itself is not destiny. Pain depends on many other things: health conditions, lifestyle, activity level, stress, and how pain is understood and treated. Now look at imaging. When researchers scan people who have no back pain at all, they find that so-called degenerative changes, disc bulges, disc height loss, facet joint arthritis, are extremely common and become more common with age. By age 50 or 60, well over 2/3, often over 90%, of people with no symptoms at all will show some of these changes on MRI. Those MRI findings are often just normal aging, like wrinkles or gray hair on the inside, not guaranteed sources of pain. They can lower your margin for error, but they do not automatically mean you should hurt every day. So, two big truths live side by side. Back pain is common in older adults and can be disabling for some, and age-related changes in the spine are also common in people who feel fine, so seeing wear and tear on a scan does not automatically explain or predict your pain. If back pain were purely about getting older, then almost everyone with an aging spine would hurt all the time. They do not. That gap between what your spine looks like and how it actually feels is where your real opportunity lives. The real enemy in this story is not cartilage wear or disc dryness. It is the story that gets wrapped around them. Older adults frequently report that doctors, family, and even friends tell them some version of, "It's just your age." What do you expect with that spine? You'll just have to learn to live with it. Researchers who talk to seniors with restricting back pain find that many believe their pain is a normal, unavoidable part of aging, and that this belief is often reinforced by healthcare providers. Other authors go so far as to say, back pain in older adults is neither inevitable nor something that should go untreated, and they point to ageism, subtle discrimination based on age, as a reason many seniors' pain is undertreated or brushed off. This matters because beliefs change behavior. If you think pain is just old age, you may not seek proper treatment or rehab. You may avoid movement and exercise that could actually help. You may accept a level of disability that is not necessary. In other words, the belief that back pain is your fate can become part of what keeps it going. Let's give this hidden problem a name: aging blame. Aging blame is what happens when every problem in an older body, every ache, stiffness, or limitation is blamed on age alone. Aging blame looks like this in real life. Your back hurts after years of heavy work, poor posture, stress, and low activity. And the only explanation you hear is, well, you're 70 now. Your MRI shows normal age-related changes, which almost everyone your age has, and it is explained to you like a death sentence. You start to see yourself as a bad back because I'm old, instead of a person with back pain who still has things that can improve. The problem is not acknowledging that the spine changes with age. Of course it does. The problem is using age as a full stop instead of a starting point. My name is Dr. Robert Ellis. For more than 2 decades in geriatrics, there have been older adults with very worn-looking spines on MRI who still garden, travel, and walk daily with manageable pain, and others with milder imaging changes who are nearly homebound. The difference is rarely just the pictures. It is how active they have stayed. It is how their pain has been explained and managed. It is whether anyone helped them build strength, balance, and confidence instead of only guarding and taking pills. Research backs this up. In older adults, the strongest predictors of chronic disabling back pain are not just structural findings, but things like fear avoidance, mood, and low confidence in their ability to move. That might sound discouraging, but it is actually hopeful, because beliefs, behavior, and strength are changeable, even when your birth date is not. So let's break down what is really going on with back pain and aging, from what matters least to what matters most for your future. First, normal aging changes in the spine, the lowest impact on what you can control. As we age, it is normal for the discs between vertebrae to lose some water and height, for the small joints in the spine to develop arthritis, and for ligaments and muscles to change. Imaging calls these things degeneration, but that word is often scarier than the reality. They are like wrinkles or gray hair on the inside, signs of time, not always signs of disease. Scans of people with no pain show that by age 50 and 60, a very high percentage already have disc degeneration or bulging, yet they do not have symptoms. This tells us that many imaging features are part of normal aging and are not by themselves a pain sentence. You can think of these age-related changes as the background conditions. They may lower your margin for error, meaning your back may not tolerate wild moves or heavy loads the way it did at 20, but they do not automatically force you into daily pain. How you move, how strong you are, and how long you stay active will influence how those age changes feel. Second, accumulated load and lifestyle, a medium impact that is very modifiable. Over decades, your spine experiences loads from work, lifting, bending, and sitting long hours, from habits like slumped posture or very little movement, from body weight and fitness, from smoking, poor sleep, and stress, all of which affect tissue health and pain sensitivity. These factors interact with age-related changes. Two people of the same age can have very different pain experiences because their spines have lived different lives. Reviews of low back pain in older adults show that risk is related not just to age, but to other health conditions, physical inactivity, mood, and social factors. Obesity, long histories of heavy physical work, and low activity are all associated with more back pain and disability. At the same time, many older adults with chronic low back pain remain surprisingly functional when they stay active and engaged. This is where your day-to-day choices matter. Simple things like walking more, doing basic strengthening, breaking up long sitting, improving sleep, can reduce the load your aging spine has to carry. You cannot erase the past 60 years, but you can absolutely change the next 5. Third, pain beliefs, fear, and avoidance, a high-impact factor that is very powerful. When pain shows up, especially later in life, it is natural to worry. Something must be badly wrong. If you are then told it's your age, you may become even more afraid of movement. You begin to avoid bending, lifting, walking far. Over time, muscles weaken, joints stiffen, and your nervous system becomes more sensitive, so smaller efforts hurt more. This fear avoidance loop is a big part of why some people's pain becomes chronic and disabling, even when structural findings are not extreme. Research in chronic low back pain, including in older adults, shows that fear avoidance beliefs, the idea that movement is dangerous and pain always means damage, are strongly linked to disability, worse outcomes, and ongoing pain. Older adults also commonly report the belief that restricting back pain is a normal part of aging, which can stop them from seeking care or rehabilitation. This is why two 70-year-olds with similar spines can live very different lives. One hears, "This is just age," stops trying, and slowly does less and less. The other hears, "Yes, your spine has changed, but many parts are still trainable," starts gentle movement with guidance, and finds that pain becomes more manageable. Your beliefs do not make pain imaginary. They change how your body responds to pain, and that response can heal or hurt. Fourth, strength, movement, and functional age, the highest impact and the most hopeful. Your calendar age is how many birthdays you have had. Your functional age is how your body behaves, how strong, mobile, and resilient it is. Two people can both be 75 on paper, but one has the spine, functionally, of a typical 60-year-old, and the other of a frail 90-year-old. This functional age is shaped by regular physical activity, especially strength and balance work, by maintaining a healthy weight, by managing other conditions like osteoporosis, diabetes, and mood, by staying socially and mentally engaged. Guidelines from major health bodies emphasize that physical activity, including strength work, balance, and aerobic exercise, reduces the risk of back pain, falls, disability, and many chronic diseases in older adults. Exercise programs have been shown to improve pain and function in seniors with chronic low back pain, and staying active is a core recommendation across guidelines. This is the part you can lean on for hope. Even if you already have pain and degenerative changes, building strength and movement can make daily tasks easier, reduce flare severity, and give you more good hours per day. Your spine may be older, but your capacity is still trainable. When you put these layers together, a different picture of back pain and aging appears. Aging changes the spine. That part is real. Those changes do not automatically doom you to constant pain. Lifestyle, beliefs, and strength often matter more than the MRI picture. You cannot turn 75 back into 25, but you can absolutely make your 75-year-old back stronger, calmer, and more reliable than it is today. For independence and longevity, the question shifts from, is my back pain just old age, to what part of this is age, and what part is muscles, movement, and mindset that I can still influence? If you start to answer the second question, your decisions change. You may choose to walk a bit more, do simple back-safe exercises, and ask better questions at appointments. You stop accepting it's just your age as the end of the conversation. You do not have to become a gym person or chase a fitness identity. This is not about six-packs or records. It is about helping you see yourself as a partner with your aging spine, not its victim. Instead of, I am old, my back is supposed to hurt, you might try, I am older, my spine has changed, but some of my pain is about how I move, how strong I am, and how I think about pain, and those things can still change. You are not too old to benefit from strength. You are not too late to learn safer movement. You are not too far gone to feel even 10 to 30% better, which for many people is the difference between staying home and living their life. If this way of looking at back pain and aging made sense to you, if it gave you even a small sense that your spine is not just a victim of the calendar, here is a quiet invitation. Over the next week, when your back complains, pause and ask yourself two questions. Is this only my age? Or is this also from how long I sat, how tense I am, how weak my muscles feel? What is one small thing I can do today? A short walk, a few gentle exercises, a better posture choice to support my aging spine instead of just fearing it. Small, repeated choices add up more than any one big decision. This is Dr. Robert Ellis. If this video helped you feel a little less doomed by your age and a little more hopeful about what can still improve, consider liking the video and subscribing to the channel. It helps more people over 50 find science-based, hopeful explanations instead of being told, that's just old age. Live with it. Your spine has years of stories behind it. Some of those stories include wear, strain, and pain. But the chapter you are in now is not written only by your birth date. It is written by how you care for, move, and think about your aging back. starting today.